So basically now we will start the common symptoms and signs of oral cancer. So let's start. Bismillahirrahmanirrahim. Okay, pain around the eyes is basically connected with the nasopharynx cancer, and pain in the ear will be connected to the base of tongue or hypopharynx. Hoarseness in the voice is the patient has the glottis. Okay, and trismus is basically when it extends to the pterygoid muscles. Dysphagia or dysphagia is a base of tongue, hypopharynx, esopharynx, loss of hearing, auditory canal, or nasopharynx. General principles of the treatment of oral cancer is the aim of the treatment is cure of the patient. In this, you have to cure the underlying condition. In palliation is basically you do not cause the underlying condition or you do the management either of it. Preservation of function, you will preserve the functions, cosmetic functions, and to achieve the minimum mortality and mobility means minimum the death rate and extension of infection. Metastatic lymph nodes, so let's start. Cure of the patient is basically related when the cancer is 2 centimeters. So you have to give a wide excision to the patient. Palliation, you do the surgery and radiotherapy. Preservation, in this you have to swallowing, speech and vision. Cosmetic, what you do a wide excision and then you do a reconstruction by mucocutaneous या osteomucocutaneous flap basically to achieve the minimum mortality and more mortality, and then you do whatever you do the lymph nodes if they are metastatic. So you do a neck dissection or curative radiotherapy that you cure it. Okay, then you have some guidelines that basically when to do the when nodes negative nick from the oral cancer means that the lymph nodes are not basically palpable. When they are not palpable, but there is actually when there is a carcinoma of the lateral tongue, floor of the mouth, patient has mandibular alveolus, which is basically occult, means hidden metastasis. There is metastasis, but this is hidden. Or occult metastasis is seen 30% of patients, and selective neck dissection is present in level 1. In level 1, what you have basically you have some mental, some mandibular. In level 2, you have the upper deep cervical lymph nodes, and in level 3, you have middle deep cervical lymph nodes, which is indicated for the tumor excision in these areas. Okay, now we will have a next we next basically there is actually this clinically nodes are positive. When the lymph nodes are positive, so in which cases lymph nodes are positive, you'll see selective supraomohyoid neck dissection. You will see it actually in N1 when you have N1 actually. Okay, मतलब nodes. And to a modified radical radical neck dissection followed by post-operative radiotherapy. The basically clinically node positive necks are there. Clinically node positive neck. Okay, and to see is bilateral radical neck dissection. Basically to preserve at least one internal jugular vein post-operative radiotherapy, and then you have a pre-operative radiotherapy. Pre-operative means before it is feasible. Radical neck dissection is later. Okay, so they were before node negative neck, and then you have node positive neck. So in which conditions you have it? It is supraumbilical neck dissection you have. Okay, yeah, modified radical radical neck dissection. Okay, then you have post-operative radiotherapy you give in this. Okay, and to CE you give the bilateral radical neck dissection in order to preserve the internal jugular vein. Yeah, post-operative radiotherapy. Yeah, pre-op and N3 is pre-operative radiotherapy, and then you do the neck dissection. Okay,